Rights and responsibilities. The Anesthesia Service at Valder Medrado Clinic is the group that provides medical services to Hospital São Rafael. We have the duty to inform patients of their rights and responsibilities. To achieve this, we have created guidelines that follow our values and code of ethics, as well as current laws and regulations. The following are the guidelines for the rights and responsibilities of patients and their families. Patients and families' rights. 1. Receive dignified, attentive, and respectful care, without any prejudice or discrimination. 2. Be identified by full name and date of birth, and be addressed by their name and not in a generic manner or by the name of their disease, number, code, or any other disrespectful or prejudiced way. 3. Be able to identify the professional through their badge with a photograph, name, and department to which they belong. 4. Receive information about the institution's rules regarding the protection of their personal belongings. 5. Have the right to receive clear, simple, and understandable information from the team assisting them, adapted to their cultural condition, regarding their diagnosis, therapeutic options, and risks involved. 6. Receive information about medications that will be administered to them, as well as the origin of blood and blood products, before receiving them. 7. Receive adequate hospital treatment to control and minimize physical pain, in accordance with the institution's clinical guidelines or protocols. 8. Consent or refuse diagnostic or therapeutic procedures freely and voluntarily, after receiving adequate information, as long as they are not in life-threatening conditions. In the case of inability to express their will, consent must be given in writing by their family members or legal guardians. 9. Have access to their medical records in accordance with the current legislation and the institution's rules. The medical records must include the set of standardized documents and information about the patient's history, principles and evolution of the disease, therapeutic measures, and other clinical notes. 10. Have the confidentiality of any and all information preserved, through the maintenance of professional secrecy, as long as it does not pose a risk to third parties or public health. 11. Receive or refuse psychological and religious assistance. 12. Have their spiritual and religious beliefs, as well as their ethical and cultural values, respected. 13. Have their safety, individuality, privacy, physical, psychological, and moral integrity guaranteed. To this end, the patient has the right to maintain their privacy, with care provided in an appropriate place and professional conduct that safeguards this privacy. 14. Have their rights guaranteed in the case of children and adolescents, disabled individuals, or the elderly, in accordance with the current legislation and the institution's policy. 15. To have the right to choose your companion who will accompany you throughout the entire hospitalization period, in accordance with the institution's rules. 16. Be encouraged to participate in all decisions regarding their care, with the guarantee that the team assisting them will provide information and clarifications regarding doubts, care and treatment results, as well as unforeseen results. 17. Be able to indicate a family member or legal guardian to make decisions regarding diagnostic or therapeutic procedures, including treatments, care, and procedures, and measures of resuscitation or other life-sustaining treatments, applicable to individuals over 18 years old or legally emancipated. 18. Express their concerns or complaints to the institution's management, through the Ombudsman Service, and receive relevant information and clarifications, according to its rules and regulations. 19. Request a second medical opinion regarding their diagnosis or treatment, and if desired, a replacement of the doctor responsible for their care, in accordance with the institution's policy. 20. Receive respectful and compassionate care at the end of their life and be treated with dignity and respect after their death, and not have any organs or tissues removed from their body without their prior authorization, that of their family, or legal guardian. 21. Have the right to respectful assistance, ensuring modesty, privacy, and intimacy throughout their life cycle, including in situations of death and post-death. 22. To have access during the consultation with the anesthesiologist to information related to the clinical staff of the service, as well as the assistance that will be provided by the team available on the day of the procedure. Responsibilities and duties of patients and family members. 1. Provide complete and accurate information about their health history, previous illnesses, use of medications or substances that may cause drug dependence, past medical procedures, and other health-related problems. 2. Follow the recommended instructions of the multi-professional team that assists the patient, being responsible for the consequences of their refusal. 3. Know and respect the rules and regulations of the hospital. Take care of and be responsible for the facilities of the institution made available to them. 5. Respect the rights of other patients, staff, and service providers of the institution, treating them with civility and courtesy, contributing to the control of noise, number, and behaviors of their visitors. 6. Be responsible for any expenses incurred during hospitalization and outpatient treatment or indicate the legal and financial responsible person for their hospital treatment, informing the hospital of any changes in this indication. 7. Respect the smoking ban, which also extends to their companions and visitors, in accordance with current legislation. 8. In the case of children, adolescents, or adults considered incapable, the above responsibilities shall be exercised by their legal guardians, duly qualified. At the time of admission, the patient and their responsible family member are provided with a guide containing information about the hospital services and operations, which includes the complete list of rights and responsibilities. The aforementioned list can also be easily accessed through information boards distributed in easily visible locations for both staff and patients and family members. When a right is violated or a responsibility is not fulfilled, the unit leader will seek to ensure its adequacy as a representative of the institution. Ultimately, both patients and family members, as well as the institution itself, can rely on the assistance of the Ombudsman, who will serve as an interface between both parties.